sublux almost dislocated, and then he broke the fibula here, and then he also broke off a piece of bone on the back of the tibia that I can see here. And most likely he's also torn, there's also a connection in between the fibula and the tibia called the syndesmosis, and that is probably also torn. But the way he is now, the ankle is still shifted to the side, and that's bad because it puts pressure on the skin here. And if you don't address it, the skin over this side of the ankle could actually die, and you could end up with like a big wound on the ankle, an infection, and that would be a really big problem, which is why I tell you this has to be fixed.
Okay.
Yeah.
So how do you going to?
So to fix it, once you're asleep with surgery, you're going to get 2 incisions around the ankle. Sorry, I'm also filling out your form at the same time here. You're going to get 2 incisions around the ankle. So you're going to get 1 incision that comes down this side of the ankle, and then you're going to get a longer one that comes here. We're going to line up the bone and then fix it on the inside with a metal plate and screws. The metal plate and screws can stay in forever. If they bothered you in the future, they could be removed, but we don't remove implants for at least 1 year out from surgery. And so that's something that you'll deal with if and when you need to in the future. But lots of people leave the implants in forever. Only if it bothered you enough in the future would we take them out in the future.
What do you mean by bother?
Sometimes people feel like some irritation or something like that, like from the implants. And so if they bothered you in the future, we could remove them.
Yeah. So is that the other surgery?
That would be another surgery to take them out in the future. Yeah, yep. You'd go to sleep again, we'd open it up, we'd take it out. And that's why if it's not really bothering you, most people just leave them in forever, even though they could take them out because it's another surgery to take them out. So it has to bother you enough that you would want to have more surgery done to take it out. So most people leave them in, but if it really bothers you in the future, it can be removed in the future. The risks of surgery, as with any surgery, there's always a risk of bleeding, infection, injury to blood vessel or nerve, pain, stiffness, arthritis. So the most likely things that will happen, no matter what you do, there's increased risk of arthritis in the ankle because the injury is around the joint. But the best way to try to delay and prevent that is to fix the ankle as perfectly as you can. Even doing that, it's possible that you'll still get arthritis. And then most likely you're going to lose some amount of motion in the ankle. So you should get back enough motion that you can walk around and do your activities and hopefully not be thinking about the ankle. But when you stop and you compare one side to the other, you're probably going to say, yeah, I lost some motion on this side. So we want to make this as good for you as we possibly can. And we'll probably get it to like at least 90% of what it was. But long term, you're probably